That is for fixed X-ray equipment. There is also an overarching risk assessment for handheld X-ray sets. For those who have battery-powered units, these are not fixed to any particular surface and are not mobile wheeled units that plug into the mains. Again, there's a full risk assessment to go through, and again, we ask you certain questions as we go through the process. As you will see from Part B, it is different to the fixed for a start, and it is pertinent to any handheld use of equipment. Personal monitoring is always recommended when using handheld equipment due to the close proximity of the user. So again, we ask you whether any has been done in terms of personal monitoring, and again, we ask you any results available. Operator manuals should be available, so we can indicate that within the risk assessment. So we go through. Again, we ask whether patients are ever assisted during radiographic exposures and whether carers and comforters ever assist patients. The outcomes of the risk assessment, we ask where the unit is actually used, so the room details, say surgery 1 and surgery 2, and where the practice is, again, to make that specific to this risk assessment. Move through the document. See, many of the sections are already pre-completed, but we do urge you to have a good look through them and read them and understand. Finally, because personal dosimeters are recommended for handheld use, the supplier and the dose wear period can also be included here. Which again, wear period of 13 weeks or 3 months is recommended. Those are the two overarching risk assessments. Down the left-hand side, we have room-specific versions as well. So if you click on the Add button, and you can drop down a form, and this is for each individual fixed intraoral X-ray set. So we'll take, for example, surgery 1. Surgery 1 has been entered, the make of the X-ray set in surgery 1, the model, and the serial number. And this obviously should match up with your equipment inventory. We ask you the number of exposures be taken per week for this particular unit, and then there is a questionnaire to go through in order to determine whether you need to take any further actions to restrict X-ray exposure outside the room and to persons outside the room and the operator. So we have a number of yes/no boxes. They will indicate whether you need to take further action based on the answers given. So in this case, no, but the risk assessment referral should be completed and forwarded to the RPA. And you'll see on the left-hand side, there is a referral to the RPA tab. I'll come back to this shortly. If you go through the whole of this room-specific risk assessment, and there is no indication that you should actually forward any further information to the RPA, then you do not need to do so. You've completed your risk assessment process. Then look at the equipment details itself. X-ray warning lights, are they there? Are they working? This is X-ray warning light on the actual X-ray set itself, not outside the room. Also, is there an audible, whether the mains warning light is working, and whether the dead man exposure switch. Again, we have information tablets in various different places that give a little bit more explanation about what we're actually talking about within the file. For panoramic and cephalometric, we can add in a new form here as well. And again, this is slightly worded different, but in terms of this, it's looking at each individual room where a panoramic or a cephalometric X-ray set is installed. As we go through the file, it'll ask you various different questions as we go. and the information tabs are there to provide additional information. We have one for room specific for cone beam CT. Again, we can click add, and we see that we've got a drop down form, and again the appropriate questions are asked. For the users of handheld equipment, again we can click add. And on this particular one, because we're looking at handheld, it could be used in multiple different rooms, and the questions are determined by that fact. As we move through the file, we can see various different questions and where it is appropriate to actually forward this on to the RPA if necessary. For where practices take handheld equipment off their own site to say alternative premises, we have a remote premises dynamic risk assessment. This does not happen very particularly often, but it may well happen, and it allows you to do your own risk assessment when you get to site in terms of providing adequate protection from X-rays for anybody in adjacent areas or the surrounding area. The referral to the RPA form, where it's been indicated in a room-specific risk assessment, and you should provide or seek radiation protection advice to a greater extent, you can use this form to provide us with information as your radiation protection advisor. So we'll ask you the practice name, address, etc., the make and the model of the X-ray set, the location of that X-ray set, and then we ask you to provide a plan that provides the following details. You can also download a grid paper here, and it allows you to do your own sketch plan. So then you can email it into us, and we'll provide additional comment. So that's the risk assessment process for all types of X-ray equipment. What also needs to be considered is Radon 222 gas. This is, as it says, a naturally occurring radioactive gas, and it can contribute to people's radiation dose when they're at work in an occupational point of view. So it does need to be considered. There is some information on the page regarding radon gas. And the first question asks you, is your practice in a radon affected area? Yes or no. How do you find out? You can go to the UK Radon website at ukradon.org, and this will allow you via the UK Health Security Agency's website to check whether your property is in a radon affected area. If your practice is not in a radon affected area on the map, you can just click no. If you have any frequently used sub-ground floor level rooms, such as surgeries that people frequently access, then you can tick yes on that. Otherwise, the answer is no. If both answers to that question are no, then you do not need to take any further action in terms of measurements. If either of those are yes, then you should undertake radon gas measurements within your practice. Further advice can be obtained from your radiation protection advisor, should this be the case, and how to undertake measurements and purchase radon detectors can also be given in advice by your radiation protection advisor. Versions and controls are just there as a document management system. If you create your risk assessment and call it version 1 today, but in a year's time you change it for whatever reason, you can then call that version 2, indicate what details have changed within the risk assessment, what date you changed them, and when it will be reviewed again, and a basic download a basic table for revision controls is available here, detailing what you should be recording. This will allow you to dispose of any old risk assessments, but keep a chain of what changes have been made from a quality assurance point of view.